Hey everyone, welcome back to my YouTube channel. Today I'm going to be showing you what it's like to work on the front line in the emergency department, in the ER, at the different hospitals that I work at during COVID, during the pandemic, in this crazy year that we've had. And I'm going to be showing you all the interesting, the difficult, the rewarding, most amazing cases that I've seen during this time. Obviously, for confidentiality reasons, I can't take you all the way through into different areas of the department, but what I will do is I will step out and then go through the case, what's happened, and break it down and give updates when I can. This will be a useful insight, a useful teaching topic, and something just generally interesting for you at home to be watching. And hopefully it gives everyone a bit more appreciation for the work that the NHS do for all different staff members, and show you the hard work that we're doing day in and day out. So come, let's go. Hello? Is that a cardiac arrest? Coming? Okay, so we've just got a call to go into recess. We've got a cardiac arrest coming in the next 5 minutes. So we're all ready, we're all gowned up. We've got the different team members here, and I'm going to be the team leader for this. And we're going to do the best that we can to get this patient back. I'll give you an update afterwards. Okay, so we've just come back from that cardiac arrest and the team did a very good job. We managed to get the patient back. So we went through several rounds of CPR, giving adrenaline, and the team worked absolutely fantastic. Very efficient, very thorough, and we managed to get the patient back very quickly. So now that they're stabilized, we've got the intensive care unit doctors involved, and we're going to be transferring the patient up to the intensive care unit for further care. And by keeping them under sedation and keeping them on the ventilator and giving other body system support, hopefully there'll be an excellent recovery. And that downtime that we're going to give for the brain whilst being on medications that essentially induce sleep, these anesthetic medications, will allow the brain to rest and hopefully heal, and then hopefully allow for good function afterwards. So everybody's feeling positive, so this is good. And it's just getting very warm, so I probably need to go and get some water for now, so we'll catch you in the next bit. See you then. In these cardiac arrests, it utilises a lot of team members, a lot of effort, a lot of work. So even though the majority of the emergency department may come to a standstill because we're using different resources, different staff members, we're dealing with these real serious emergencies where it is actually life and death, and those difficult decisions are being made, and the team are working excessively hard and genuinely saving lives. It's definitely worthwhile in the end. So basically, we've been having a patient that we've had to intubate. They've got coronavirus, they've got COVID, and it's pretty much taken out most of their lungs on both sides. They're needing quite a lot of oxygen. We've had them on 70% on inspired oxygen on something called CPAP, which is a machine which uses positive pressure to keep the airways open, and the patient's been struggling. Tried all different ways to get them a little bit better. They've had antibiotics, they've had the steroids, they're having fluid to keep the blood pressure up. They're needing a little bit of support, so we've had to get the intensive care unit involved. That essentially means that we're going to be putting them on a ventilator, so that means having to tube them, putting a tube through the mouth into the lungs, and essentially taking control over their breathing. So we're literally getting prepped for that. Alright, so we've tubed that patient and we've managed to do everything successfully and nice and safely. and we're just going to get ready to transfer them to the intensive care unit. They're just getting one of the beds ready. It takes a bit of a while, so should be ready pretty soon, and then hopefully then we'll be off, and the patient then can continue on their journey, hopefully get them better. They're definitely stable, which is a good thing, and continue antibiotics, steroids, fluids, vasopressors. These are powerful drugs to squeeze the arteries to keep the blood pressure up so that the blood can keep flowing to the brain, the heart, the kidneys. So hopefully, fingers crossed, we're doing a good job, and yeah, let's keep going. Just got to write up the notes and then type some things up onto the computer. Just got to do the admin work alongside this for the note keeping, and then we'll go on to the next patient. Alright. Okay, trauma call, ETA, 5 minutes. Thank you, I'll be there. Get the team together. So we've just got a call in from the ambulance service that they're bringing in a patient who's been involved in a road traffic accident. Hit quite severely on their side, indentation to the door, they had to be cut out. So they'll be here in about 15-20 minutes. So we're just going to get the trauma team together. Essentially, the trauma team is us as the team leaders from the emergency department, so I will be leading the team. And then we've got the orthopedic doctors, which are the bone doctors. We're going to be having the general surgeons, so surgical doctors. And then we're going to have the team from the intensive care unit, so intensive care unit or anaesthetics. And we will go through a procedure of taking a handover and then assessing the patient, going through airway, breathing, circulation, checking disability, assessing the patient essentially from head to toe. And then we'll make a management plan and do investigations, figure out what's happening, and then to stabilize the patient accordingly. So I'll give you an update afterwards. Okay, so we've seen the patient. They seem pretty lucky and they've pretty much got away without having any other significant injuries, apart from unfortunately having quite a significant injury to their hip. All we can see for the moment is that they've got significant pain at the hip and the knee, and quite a lot of bruising. So actually we need to go for further imaging. Now, due to the nature of the impact, it means we're going to need to go for a CT scan of the abdomen and the pelvis at least, and then we're also going to take some x-rays of the knee to see and assess what's happening. So I'll show you some pictures afterwards, hopefully once we get them. Okay, so we've had some imaging back, and we can see from the CT scan that the ball and socket joint, which is where the hip joins into and in the pelvis, there's essentially been a fracture there. It's indented into the pelvis, it's been crushed in, so quite a significant impact. Patient's very stable, which is very good, very positive, and the knee actually has a tibial plateau fracture, as you can see from the image that I'm going to be putting up here. So somewhere here or there, whichever way, we'll figure it out afterwards. This person's going to need some orthopedic intervention, meaning that they're going to have an operation, and because of the nature, we're going to have to transfer them to our local trauma centre. Even though we are equipped to deal with certain types of injuries, this nature of this injury deserves to be at a trauma centre. So we've stabilised the patient, and now we're going to be transferring them across. So we just got to make sure we get the paperwork ready and do the appropriate handovers to the ambulance crew so that they can safely transport and deliver this patient for the orthopedic team at the receiving hospital. So we're just going to get everything sorted out. Okay, so I've just seen a patient who's potential stroke that was called in, and I've examined them, and they're not able to use their left arm and left leg. We've got an onset time, which is very important because these patients we have to treat within a certain time frame, so we don't really have long in order to make sure we instigate the right treatment, which is essentially something called thrombolysis, which is using a medication to break down the clot that has caused the stroke. So we've got the stroke team involved as well, and they're here assessing the patient and doing their checks, and essentially we're going to be giving this medication and hopefully it does the trick. Now what we're looking for is essentially the arm or the leg starting to move, which it's not doing at the moment. So fingers crossed we have some good results. We've managed to give the thrombolysis, well, the stroke team has given the thrombolysis, and we've been assessing the patient, and we've got some decent improvement. We've got movement of the left arm, and before it wasn't moving, and now we've got some movement there, which is very good. Yeah, this is good. It takes a bit of time for it to have complete full effect, for the neurological function to return back to normal. So this is good, it's positive. Patient's going to be moved to the stroke ward to be cared for appropriately by the correct team, which is the stroke team, and they'll have the physiotherapists working with the patient and the specialist nurses and the nursing team doing all the good things that they need to do to help get this patient better. And then hopefully what we want to see is really as good as a recovery of movement of the arm and leg, so reducing the disability that the stroke would have caused if this treatment wasn't given. So this is excellent news so far. Unfortunately, from our point, from the emergency department, we don't really get to have further care or input in these patients, so from here on they're under the care of the stroke team, and we say goodbye to them from here, and we wish them the best for the rest of their journey.